Hello and welcome to Health Live at Seniors Today. Today we have a leading sexologist, Dr. Deepak Jumani. Dr. Jumani will speak and answer questions on sexual health for senior citizens. A little about Dr. Jumani. Professor and Dr. Deepak Jumani is a distinguished senior sexual health physician and counselor from Mumbai. He is attached to the Sir J.J. Group of Hospitals and the Grant Medical College as a Professor of Medicine in Sexual Health. He is also attached to the Mumbai Police Hospital, Doctor House and Apollo Sugar Clinics as the Consultant Sexologist. He is an American board certified clinical sexologist and a fellow of the American Council of Sexologists. He is the course director of the fellowship program in clinical sexology started by the Maharashtra University of Health Sciences. And this is the first approved course in sexology by the MCI. He was also the chairman of the Indian Medical Association's initiative of sexual health, a pan-India sex education program. He's one of the members to form a consensus for the management of erectile dysfunction in Indian men. He has contributed several chapters in various textbooks and journals of diabetes and endocrinology on topics related to sexual dysfunction. He's the author of the book, Sex Has No Expiry Date. And just yesterday, I got to know that he has been granted the exceedingly prestigious FRCP from the United Kingdom. Welcome to Health Live at Seniors Today, Dr. Jumani.
Thank you very much, sir, for that sexy introduction.
I must confess to you that we were wondering whether we should do a Q&A on sexology, but of the various articles that we have published over the last 2 years that we've been in existence, one of the most popular articles, one of the most read articles, was an article on sex during COVID, and this was published last year. And clearly, the feedback that we received from there was that people were wanting to know more about sexual health, and especially senior citizens. So, with that background, we searched you out and we decided to invite you. So before we start, Doctor, would you like to say a few general words on sexual health for senior citizens? And those of you who would like to ask questions, please feel free to put it on the Q&A tab here. If you want to ask it anonymously, you can do that. If you want us to not take your name, please mention it clearly and we will not mention your name at all. We have received a few questions already via email, but feel free to post them here on the Q&A mode, as on the Q&A tab as well as the chat tab. Thank you. Over to you, Dr. Jumani.
Thank you very much. First and foremost, let me tell you that sex is a long subject where nature and cultures collide. Can we navigate through the mysteries of sex? Or can we develop some sexual intelligence which deepens our understanding about this pleasure? It's the best connect which a man and a woman can ever have. We are born sexual and spiritual. We cannot dichotomize any one of this. Doctors never ask their patients about their sexual dysfunctions. Patients never come out and tell openly about their sexual problems. So there is a gap. There is still a taboo. All across the globe, it is a taboo. As we age, during the process of aging, we develop a lot of metabolic issues. We may develop diabetes, we may develop hypertension, we may become obese, our lipids can go haywire, and forget all these things, metabolic things. We age, which is inevitable, which we have to. But as we age, let me tell you one thing, that intimacy is inevitable, is ageless. Intimacy has no barriers. It does not have age. We are all born out of love, and love doesn't expire. So I feel, and I strongly believe, that sex really has no expiry date. You can have sex from 9 years to 90 years. That's my challenge to you. We have patients who are 90, 92, they still have very good enough sex and they are enjoying about it. So I feel today this webinar should be an eye opener to all senior citizens who have got a lot of inhibitions to talk about it, who have certain myths which are all culturally inhibited, culturally intertwined in them, or due to environment, or due to some shyness or whatever it is. We need to break this inertia and just talk about it. And if you don't talk about it, you won't get any solutions. But if you talk about it, you'll surely have solutions for it. I'll be very happy to answer any questions from the audience, August audience, which I'm facing. Over to you, Pradyumna.
Very well said, Dr. Jumani. I think the points that you made are very well received by our people. We have a fair number of people who are there at our Facebook Live and a lot of people here attending also. I will get on to the questions right away. So we have a question from an anonymous attendee who says, my parents had a love marriage and love faded in 10 years. My mother had one affair after another. My father drank himself to death. Now at 72, my mother wants to marry again to a man who's 15 years younger than her, and he gives her sex and she has money to pamper him out. Family and friends say horrid things about us. I'm very ashamed, but can't do or say anything because she still controls all the money which was hers to begin with. What would be your advice? I know it's not exactly a sexology question, but it is, we have received a few questions like these.
See, this is one of the similar situations which we see in our day-to-day life, like there are a lot of couples who are not satisfied with their sex life. 40% of men are not satisfied with their sex life across the globe. The study says 62% of women are not satisfied with their sex lives. 50% of married couples in Japan, in the most developed country like Japan, are living sex-starved life. And today, we are seeing an increasing number of divorces, and 1 out of 5 divorces, the reason is sexual dysfunction, either in the male or a female. So it's very, very common, whatever you said. Now, when I look at the lady who's still alive, I feel her pleasure is her right, her pleasure is her business. Who are we to stop her from getting the pleasure what she wants? We shouldn't stop her. That is what I feel. And if she's willing to get married to somebody who's 10 years younger or 20 years younger or 10 years elder or 20 years older, it doesn't matter. Age, weight, height, these are all just numbers. If it is consensual, if both of them like each other, it's their life, let them enjoy. So I would not listen to 100 people who would speak sheepish or speak something rubbish about the woman and all that. No. Sex is the most strongest urge of every human. It's the highest desire every man or a woman has it. So it's nothing wrong if she's getting married again, no problems. It's right. If it is consensual, who are we to stop them? And why should we stop to them? If she's willing, it's her pleasure, it's her life, her decision. Let her take it. Nothing wrong in that.
Right. Thank you. Very well said. We have a question from somebody who's not a senior citizen, but it's interesting, a question and which may appeal to many more people. I'm 46 and good looking. On the other hand, my wife is 40 and very fat. We have 2 children and both of us have lost interest in each other. I can't have sex with her. I love watching porn. Is it all right to explore Tinder?
Explore Tinder.
Yeah.
See, one partner being obese and the other partner is not obese. Okay. So today we give more importance on image, body image. There are thousands of ways where if he loves her, can motivate her to reduce. You can challenge your body to whatever way it wants to function. If you're obese, you can definitely, if you're moribund obese, you have bariatric surgery to go for it. You have a lot of other ways to reduce: dieting, exercises, so many beautiful things are available. Non-invasive liposuction can reduce. So that body image issues, if it is setting in something like a turn off for this man, that's not the right thing for him to do. So he should motivate her to reduce weight and forget the weight. Even if she's obese, they can still enjoy sex by changing different positions. It is not that she has to come over him or he has to go over her by the missionary position or whatever it is. They can change the position and they can enjoy sex. Sex can be enjoyed in any positions, in any shape of the body which you have. It is immaterial. It's all in the mind. Because when I look at any particular female, uh, below the waist, every female looks to me the same. There's no difference. So if at all this man who's feeling not interested in her partner because of her obesity, that's wrong. He should motivate her to reduce weight. There are lots of techniques available today. Within 6 months to 9 months, she can come back in whatever shape she wants to, and they can enjoy sex life. Now, regarding what Tinder or watching porn, etc., I feel, this is husbands watch porn and their wives are working in the kitchen, and their wives know what is the husband doing. And the signal which this man is giving to his wife is that he likes the girl in the movie more than her, which is absolutely wrong. He should not do that. He should not watch porn alone. He should watch porn with his partner. That much he can do and get excited. And the male should criticize the girl in the movie more and appreciate the partner. By doing this, he's elevating her, exciting her, in giving her motivational incentives to be more intimate and get all the sex what he wants. He's not going to get sex from the computer or mobile or laptop or anything like that. He would get sex from the partner, but he needs to get excited. And because we all are interested in having variety. Variety is the spice of life. See, sex is the same, penis going into the vagina, but initiation of the sex has to be very different in every time when you do, to rekindle or to spice up the whole thing. So he need to understand that if you're watching porn, watch together and criticize the girl in the movie more in front of his partner. So that is the key for him to increase his intimacy, increase his attachment towards his wife, and also get the sex what he wants from his wife.
Thanks, Doctor. We have a question from someone who says, I understand that testosterone is the main hormone for man, which gets reduced as he gets older. How does one keep it intact in the old age, given a sedentary life? We also have a question from someone who says, Doctor, please tell us about Viagra and what else we can do and consume amongst natural foods for a healthy sex life.
Okay. So for every patient who has got erectile dysfunction or any other sexual dysfunctions, diet forms the most important part of his life, because it is the diet which will make him more sexier. Because when you uh, look at Aphrodite, who was the Greek symbol of beauty and love, she was so beautiful, so alluring that she could make any man fall for her. And she was amazingly beautiful woman on this earth. Then what did she do in ancient age? Did she do any bariatric surgery? Did she go to any parlor or anything? Nothing. The secret of her, whatever she was, whatever beauty she had, whatever sexiness she had, whatever appeal she had, was laid only on the food what she had. This superfood which she had is also available to us. That is one aspect, that why diet is important. Second thing, today when we look at blue zones across 5 cities in the world where people are staying more than 100 years, they have forgotten death and they are still sexually active. Now these people who are staying more than 100 years, which is a truth today, Dan Buettner, who's a National Geographic scientist. He visited these 5 cities across the globe, and he studied these people, what were they doing, and he came to the inference that it is the diet which is responsible for their being active, being sexy, being healthier, etc. So this is one thing. Now, medically, when you see, if you look at patients who have got heart diseases, if you heard the name of Dean Ornish, who was an American cardiologist, he proved that even 98% blocks in the coronary artery can be dissolved with nutrition, with lifestyle modification. He has proven, he has published his data. Cleveland Clinic also said that by nutritional intervention, you can halt the process of atherosclerosis and also reverse it. So nutrition plays the best part in our life. Now, when one can ask, what is the nutrition which we should take? I will first tell you about the lifestyle, what a man should after 40 have. I don't want to give any specific diet because nobody can adhere to any particular diet which is given by the dietitian or the diabetologist or anybody else. Nobody adheres to one particular diet for his whole life. It is impossible because we all are busy, we are all working, we have to travel. We can't follow this and we can't mentally digest ke ye mat khao, wo mat khao, 9 baje itna khao, 9:30 baje ye lau, 10 baje ye lau. It's stupid to, I mean, it's not everybody's cup of tea to follow such a regime or regulate himself or strategize himself to, diet ka thing at 9, 10, whatever you want. Now, what I tell my patients who are above 30 or above 40 or who have a family history of, say, diabetes, blood pressure, cholesterol, lipids, etc., or having heart disease. So I tell them a very simple formula to follow. I tell them that you have to cut down on SOS. Now, you will ask me, what is SOS? The first S is salt. If you take excess of salt, you are likely to get hypertension, that is high blood pressure. Medicines will be for lifetime. Again, it's a killer and it causes sexual dysfunctions. So reduce S in your diet as you age, about 30 or 35. The second of SOS is oil. O is for oil. If you take excess of oil, you will get dyslipidemia, atherosclerosis sets in faster. You will have to take medicines for lifetime. It will cause sexual dysfunction and it is a killer again. The third is S of SOS is sugar. If you take excess of sugar, you would get diabetes, medicines will be for lifetime, there will be sexual dysfunctions and it's a killer. So simple advice is reduce salt, oil and sugar in your diet after 35. You will retard the onset of every complication in your life and plus also your sex life will be rocking. Some patients ask me, doctor, tell me specific food what I should take to increase my rigidity of the penis or erection because my penis is very flaccid. It is not, there is no strength in it. There is no rigidity in it. So I tell them that the rigidity in the penis, see, penis does not contain any bone. Okay, it doesn't contain those muscles which we can tone and make it hard. So what is it in the penis which makes it rigid? Penis contains of nothing else but sponge. There are a lot of spongy tubes, multiple horizontally placed spongy tubes in 2 bundles, which are then covered with a little harder tissue, and above that there is a skin. So the architecture of penis is nothing else but horizontally placed spongy tubes. Now these tubes are always closed, hence the penis is small. Whenever these tubes open or dilate, there is a rush of blood and that's erection. So erection is nothing else but blood and the flow of blood inside these spongy tubes of the penis. So if at all you want to have good erection, you should have a good blood flow inside the penis. Now, how do we increase the good blood flow? Blood flow can be increased by increasing the blood, eating the food which increases the blood, and doing certain exercises which can pump the blood inside the penile spongy tubes. Now, what are the diet? What is the food which will really help every male to increase the blood or a female to increase blood in the pelvic area to get more lubrication, more orgasms and feel healthier? The color of the blood is red, right? So I give them a very simple way of remembering the food which is good for them, or making them sexier, or making them more healthier sexually. All red colored fruits: kalingar, anar, cherries, plums, strawberry, raspberry, apple. All red colored vegetables: gajar, beet, tomato. Cow's ghee and cow's milk, kanda, adrak, lasun, flax seeds, sesame seed, and saffron. 6 to 8 almonds, 1 to 2 pieces of walnuts, 1 spoon of honey. Figs are good, avocados are good, dark chocolates are good, vanilla is good. If you're eating non-veg, white of the boiled egg is excellent, and fish is excellent. This food will never make you weak, or always will make you increase. You will never be anemic. You will be never be deprived of your energies what you need during the sexual act. Now, ये तो food हो गया which will increase the blood. Now, how to pump the blood inside the spongy tubes to make it more rigid? There are certain exercises which we can teach our patients when they come to us. We can make them do those exercises of, these are Kegel exercises. These are many stop and speed. So many exercises are there which we teach our patients, with which they can pump the blood inside from the inside the penile vasculature or the pelvic area, and they can get good erections. So this is what everybody should understand. Cut down on SOS after 30 or 35 if you have a history of family history of metabolic syndrome, and follow this particular type of food which will make you healthier sexually.
Thank you, doctor. We have a few questions that have come in from an anonymous attendee. I'm 68. I have an enlarged prostate. Does having sex or masturbation on a regular basis help reduce the prostate enlargement?
Good, very good question. Studies have shown that a man having 2 ejaculations per week reduces the incidence of heart attack by 50%. 50%. Okay, so that is the study shown. More the sex, if you are able to do it, you are healthy. The penis is the barometer of your cardiac health. If you're having good enough sex at any age, your heart is normal. Because whenever the coronary arteries get blocked, say you have 80%, 90% block or 50% block, the penile arteries get blocked 3 to 5 years earlier than that. So if you are able to get good erections, your heart is absolutely normal. That's why when we tell our patients that you have, our doctor friends, when I go to the conference, I tell them that please ask one question to your patients. Do you have problems in making love? Because if he gets angina, or if he gets an heart attack, or if he undergoes angioplasty or bypass, you have missed the boat. He's already got blocks. But if you ask the history of erectile dysfunction, which gets set in after 50% of the penile arteries get blocked, the coronary arteries take still another 5 years to get blocked, because the diameter of the coronary artery is much larger than the penile artery. So penile arteries are the first to get blocked because atherosclerosis is generalized. So if you ask this question, this can be a boon to your patients, where you can change his lifestyle, you can reduce his blood pressure, cholesterol, diabetes, and counsel him to quit smoking, alcohol, make him do workouts, and give him certain medications and change his lifestyle. So you need to ask these questions, which is very important. And with prostatic issues, there are certain patients who have got lower urinary tract symptoms. They get early ejaculation, they do get erectile dysfunction. But now we have got so many medications which are available, which can reduce this prostatic size, and they can have good sex life. It is not an issue. Prostate is sometimes enlarges as we age. There is always a benign prostatic hypertrophy which is due to aging, which is there.
Thank you. We have another question which is prostate related. This person says, my husband has an enlarged prostate. He's 62. He often hankers for sex, but I'm unsure. He is hesitant to ask this question to his doctor who's actually my brother. What would you advise?
Just come again. I didn't hear because there was a lot of noise here.
Oh, the question is, my husband has an enlarged prostate. He is 62. He often hankers for sex, but I'm unsure. He's hesitant. He is hesitant to ask this question to his doctor, who's actually my brother. What would you advise?
No, let him have sex. Why you are stopping him? Nothing wrong in that. If he's able to do it, let him have it. It's not going to harm him. It's not going to give him heart attack or something like that. It's like graying of hair. Do we don't have sex when your hair is got gray? No. It's like getting a cataract. Once you get a cataract, do you stop having sex? No, it's an aging process. Benign prostatic hypertrophy is a normal aging process. It is not going to harm him if he has sex. Nothing wrong in it.
Right. Thank you. We have a question which person says, after what age would you say is the usage of condoms not necessary if the man and woman are both 60 plus?
After 60 plus, why you want to use condom? She's not going to become pregnant. What is the issue? If you are having no sexually transmitted infections, or if you are monogamous, if both of you are healthy, you don't have to use condoms. Why you have to use condoms? Get rid of condoms. No need of condoms. Why you want to use condoms?
Thank you. We have a question from someone who says, I'm 62 years old and quite normal sex life, but about 6 months back, suffered from COVID-19. After this, I have lost the sexual urge. Please advise me the course of action.
Yes. A very, very interesting thing. There have been a lot of studies now on COVID and sexual dysfunctions. When they say that in COVID, we have pulmonary, the problem is in the lungs. The virus affects the hemodynamic system of the lungs. There is oxygen saturation which get reduces. So the exchange of blood oxygen is hampered. That is one thing. Along with this, there is also the inner lining of the blood vessels which get hampered. That's called endothelial dysfunction. Now these two, along with the stress of COVID, makes patients vulnerable to get sexual dysfunctions. And if endothelium gets damaged, there is definitely patients, males, who get erectile dysfunctions. And along with erectile dysfunction, what we have seen in COVID patients, they lose the sense of smell and the sense of taste. Now, what happens, this virus affecting the nasal thing and also affects the pheromones and the nasal center in the brain. So you stop producing pheromones. Now smell is a aphrodisiac, so that is hampered. Now taste is lost. There is no saliva. Saliva contains testosterone. See, when you kiss or when you watch something erotic, you have a secretion of saliva. That is because of the testosterone. And when we do test, we do it from the saliva also. So saliva contains a lot of testosterone, and COVID hampers this. So definitely, when these patients who have got COVID, they have loss of pheromones, they have loss of less testosterone, plus the endothelium lining of the blood vessels gets hampered. That is endothelial dysfunction. So they are breathless. So they definitely get erectile dysfunction, which is there. But once the virus is cleared from the body, these are all reversible things and they will all get it back. Nothing to worry about it. They need to take the antiviral, favipiravir, whatever treatment is being advised to them, certain antibiotics and all that. And initially, they may need certain testosterone preparations. One thing very important I would like to tell all the seniors is, see, giving testosterone is very easy because after we age around 40 and above, our testosterone is going to reduce. That is for sure. But we have a catch here. If we find somebody whose testosterone is very low and his desires are low, we need to give him testosterone. That's for sure. But if at all we have to give testosterone, it has to be given for lifetime. That is one thing. And there are certain contraindications of testosterone replacement therapy. We can't give it to patients who've got prostatic issues because they may develop prostatic cancers. We can't give it to patients who've got heart failures because they may precipitate heart failure again and again, and there may be repeated hospitalizations. So giving testosterone is a challenge If and you have to study, you have to monitor the PSA levels, etc., to see if prostatic issues and the other issues are not increasing. So you got to monitor them if at all you want to give testosterone. But today we have got something which is much better than testosterone and which can give them the desire which they have lost. We have got preparations of fenugreek. Fenugreek is nothing but methi in a saponized form. If it is given, the chemical composition of fenugreek is exactly like testosterone. Now, what this fenugreek does, when you take fenugreek along with L-arginine, which is a protein, which is an amino acid, which increases the nitric oxide in our body and increases the erectogenic mechanism, this combination of L-arginine and fenugreek definitely helps in increasing the desire, increasing the blood flow in the penile, in the pelvic area. Now, what fenugreek does is, fenugreek increases the free desire in the in the human body, and if the free testosterone increases, patients have the urge to have sex. They start getting their drive back, getting libido back, and it is very easily available. It's a natural food, it's a medical food, it's a supplement which you can take it like that also without any problems. You can still take it after the age of 40. I would advise everybody to take little L-arginine and fenugreek in a saponized form. There are a lot of companies which are selling it over the counter and also on prescriptions. And these are very safe, natural, complying with our body and give them what they desire. And there are no side effects like synthetic testosterone if we are ready to give to our patients, with the risk of they getting cancer of prostate and other things, etc. So this is what is important in the diet and in issues with the
Right.
prostate.
Thank you. We have two questions which have come on Viagra. One is from someone who's 75, who says, "Can I take Viagra before sex? If yes, what is the dose recommended?" He says he's a patient of diabetes.
Okay.
And the other question that is there is, what is your opinion on Viagra? Can we have it without a doctor's prescription?
No. I'll answer the second question first. No one should take Viagra without doctor's prescription. Because Viagra, though increases the penile blood flow, gives you erections, that's okay. It's a PD5 inhibitor, that's a very good drug. I also prescribe it. But there are a lot of contraindications. There are a lot of side effects of it. Now, what are the contraindications? The biggest contraindication in adults is if he's on nitrates, like sorbitrate, glyceryl trinitrate, which most of them who having heart disease have it. If they are taking nitrates and taking Viagra, they will land up with low blood pressure and collapse. So this is the one thing which they have to remember, that they should not take Viagra without the prescription of a doctor, without the knowledge of a doctor, without telling them that he's also having certain other drugs like nitrates, etc. So that is one thing. If he has got certain deformities in the penis, like Peyronie's desire, the curved penis, he should not take Viagra. If he has got some lymphomas or leukemias, he should not take. Or if he has had a recent cardiac event, he should avoid taking Viagra. So Viagra is a good drug for erection, but there are a lot of contraindications to it, which patients should not take it without the consent of a doctor, without a prescription. And why they should not take it without a prescription? There are a lot of counterfeit, false, duplicate Viagra medications sold in the market. Viagra is expensive, but there are a lot of people who have manufactured the same type of pill and are selling it at half the rate. So please beware. Don't take it without the prescription of a doctor, and take it from a reputed chemist, the genuine drug if at all you want to take. Viagra is wonderful. I have no whims and fancies about it. PD5 inhibitors are the best pharmacotherapy for erectile dysfunction. Even in diabetics, you can give it for a longer time. But what I advise all my diabetic patients is that you need to bring down your HbA1c level to less than 7, or at least till 7. That is one thing, and which is possible today with lifestyle modifications. Plus, for diabetics, there are two beautiful drugs which they have to take for their own, for bringing the sugars down. One is metformin, and another is SGLT2 inhibitors, which are the newer drugs. Now, these two medications not only reduce his weight, bring his cholesterol and also into normal range, bring his blood pressure into normal range, also reduces weight, and also brings his sugar under control. So if he is taking these two drugs, his metabolic milieu becomes normal. And if that becomes normal, why the hell he needs PD5 inhibitors? He will get physiological erections what he wants. And imagine if anybody is taking, younger patient, say 30-year-old who has got nothing, he takes Viagra. Now, if he takes Viagra, he gets erections which are unrealistic. And he starts feeling that this is the type of erection I should get, which is wrong, which is not correct. We need to have realistic expectations in life. And for every diabetic, my advice is that if they can take metformin and SGLT2 inhibitors and follow lifestyle modifications like not taking sugars, reducing the salt, reducing the oil, work out for 20 to 25 minutes per day, 5 times a week, and avoid smoking or excess of alcohol, he can become normal. He can get physiological erections what a normal man gets it. He will not need Viagra.
Thank you, doctor. There's a question from someone who asks, what about Ayurvedic equivalents of these medicines?
See, Ayurvedic preparations are lots of there. There are Ashwagandha, Shilajit, so many are there. But there are no robust studies for it. We allopaths, we know even if we have to give one pill to a patient, we see medical evidence base of these particular medications. Every drug has to pass through certain FDA approvals, certain trials, first, second, third phase trials, and then only it is brought in the market. So about other things like Shilajit is very good, Ashwagandha is very good, Brahmi is very good. So many preparations are available. They are known to be good. They are there written in the epics. There are people, ancient people tell us, but we as men of science will accept everything when we see certain data, when we see certain medical evidence, like a trial done on say even 1,000 or 2,000 patients who have these problems, and they gave them a Shilajit or Ashwagandha and they did get it. I don't say that these are bad. These are very good drugs. I recommend also. I tell them take it, but I don't guarantee them that this is giving you as good as the result, or it may give you or it may not give you. But I cannot, keep these things at the same platform of the pharmacotherapy which we give, which is medical evidence based. I have nothing against the Ayurvedic preparations; they are wonderful. I have also taken Shilajit. I have taken Brahmi when I was small. I still take it. Brahmi is very good for memory. It's an antioxidant. It's a wonderful. Shilajit gives you strength. It gives you more energy. It's known for it. Ashwagandha is beautiful. So these are all very good herbal preparations, Ayurvedic preparations, but there is no robust study which can definitely, let us give everything offhand.
Doctor, what about crystals? Is there something about crystals and good sexual health?
Yes. Now, see, collecting crystal is my hobby.
Oh,
now, why did I develop hobby? I've got 750 Ganesha crystals. Now, I love crystals because crystal has taught me a lot of things. It's been my teacher. Now you'll ask me what crystal has taught. See, look at any crystal. It's transparent, correct? Who would not love anybody to be transparent in his life? Even in a relationship, transparency is the most important. So crystal has taught me to be transparent throughout, number one. Number two, take any crystal and keep it under the bed or in the cupboard, under the mud or anywhere. It will never lose its sparkle. So in life, whatever situations you get, you should never lose your cool. Second. Third important thing is, when you look at a crystal, say you go at a Swarovski shop in a mall, you just walk by, or at the airport when you're passing by, you will halt for a while. You may not buy it, but you will halt. It has got a calming effect. It got a tranquil effect in it. You may not buy it, but yes, you will feel that it's nice, it's good. And lastly, Dr. Mesmer, on whose name mesmerization was coined, he used to use crystal to alleviate pain of terminally ill cancer patients. So it's got a therapeutic value also. And crystal is amazing. the vibes, the shine, it really makes you calm. It reduces your anxiety before performance, during performance, after performance, and that's very important for even sex life. These are the advantages of crystal, and that's why I collect crystals.
Doctor, I think we are running out of time and we have quite a few questions, but I'm going to take a couple of them. One is by someone who said that I have gone through a circumcision. The operation is not done properly. Uh, another another doctor is suggesting plastic surgery, cosmetics. Is it advisable?
It it's very difficult to opine without seeing. Now, why is he having any sexual dysfunction like erectile dysfunction or any other issue? Why circumcision is not a reason why he should not be able to have sex, and why is the plastic surgery needed? What else he wants to do? The plastic surgeon circumcision is either done for certain conditions like phimosis or paraphimosis, or certain growths on the prepuce, the skin below the skin ahead of the glans penis, or there's a long skin, they remove it. It is also done for religious purposes in Muslims, and in Jews they do it. So it's a normal procedure. It does not cause. In fact, many there are two schools of thought. Some feel that it gives you protection from HIV, etc. Also protects you from a lot of other diseases which are possible. But circumcision causing sexual dysfunction, it's very less chance. Why the plastic surgeon wants to do something and wants to reconstruct something, or instead of circumcision something else has been done, I need to see these patients, I need to evaluate, and then I can give my opinion on this.
Thank you, doctor. We have someone who's 77, male. He stopped having sex due to dysfunction. He's diabetic. His GP has advised Viagra, but it did not work. What should he do?
See, as I told you, erectile dysfunction is nothing but inability to get erection and sustain erection for a good sex act. Okay. Erection is nothing but flow of blood inside the penile spongy tubes. You agree to me? Now, what happens in diabetes? In diabetes, these spongy tubes, which are elastic, which make the blood flow, this elasticity is lost in diabetes. So instead of getting erection, the penis is permanently in a flaccid state. That's one thing. Now, patients who are diabetic, my first aim and goal is to control their diabetes, make their HbA1c come to 7 and less than 7 by whatever means, by the two drugs which I mentioned, even if they're taking insulin, nothing. They must bring down their metabolism to a normal, be it diabetic or even hypertensive or even dyslipidemia. So if they bring down, if they make their metabolism under control, which means there is no further damage going to happen because of the sugar, because of the glucotoxicity or lipotoxicity, these PD5 inhibitors will help. And second thing, this patient who's 70-year-old, his testosterone is also low. Now, if you look at the male sexual response, which begins with the desire, now desire is all because of testosterone. This desire leads to arousal, which is erection, then ejaculation, and then resolution. This is the male sexual response. Now, at the age of 70, he may be having less testosterone. We call it hypogonadism. The testis may not be producing enough testosterone or may not be producing any. So he will need something to increase or to refill the testosterone which is lacking in him. And once he refills that testosterone, he brings down his blood sugar, testosterone is maintained, and then if he takes PD5 inhibitors like Viagra, it will surely work on him. Otherwise, it will not work on him. So this is what he has to follow.
Thank you. Just two questions very quickly. One is from a person who's 66 years old, a widower. How many times can he masturbate in a day? He's on medication for BP, has undergone angioplasty 15 years. So his question is, how many times can he masturbate in a day?
I see, I give him a simple example that you have a car, you have a license. How many times can you drive? there is no set limit, you know. But every driving also, there has to be a discipline. You shouldn't overspeed, you shouldn't overtake from a wrong side. So masturbation is normal, healthy, and beneficial, but we need to have certain limits. We don't have to go on the terrace and masturbate. We don't have to torture yourself and masturbate. So follow certain discipline. Masturbation is not harmful, and there are no set parameters or limits that you should masturbate once a day, twice a day, thrice a day. Because what happens after masturbation is you ejaculate, and the semen, the production of semen goes on continue. That factory is open 24/7 from 9 years to 90 years. So even if you are ejaculating again after 3 to 5 days or 7 days, then more semen is formed. Again, you can ejaculate. So there is you lose nothing when you are masturbating. It's normal, it's healthier. Because why I say it's healthier? If you look at a boy who's 24 years old, okay, uh, if he wants to, he has urge to have sex. So what he will do? He will either make a girlfriend and have sex with her, and she may become pregnant, and that will be an unwanted child. Is it right for him to do so? Wrong. He should not do this. Suppose he doesn't have a girlfriend, he'll go to a prostitute or a sex worker and may have sex with her. He may get infected, which is again wrong. So he should not either have girlfriend with whom he's not committed and have sex, or he should not go to a prostitute and have sex. Now, the third thing, if he doesn't have a girlfriend, doesn't go to a prostitute, the urge may be so much that he may rape somebody. So this is also wrong for him to do. So in all the three situations, if he's not in a committed relationship, he should not have sex. But if he's masturbating, is he making anybody pregnant? No. Is he getting infected with HIV or no? Is he doing any crime? No. So masturbation is normal, healthy, and beneficial. It is said that if people who masturbate do not get prostatic cancers in their later life. Okay. And if a man who says he's not masturbating, there are only two reasons. One, he's telling a lie, or second, he doesn't have a penis.
One last question, doctor. This is someone who says, can you specify 2 or 3 exercises, yoga or otherwise, that helps reduce and enlarge prostate?
I can't show it on phone, but Vajroli Asan and Vajroli Mudra, these are the best. Kegel's exercises are the best. They can call me, I will tell them, and I will explain to them on video, because it's a very long thing to explain online like that.
Thank you, doctor.
But there are beautiful exercises which we can teach them.
This is Vajroli Asan.
Yes.
And doctor, if anybody does want to teleconsult you, is there some way in which they can do that?
Yes, yes. My number is 98210-44556. You can flash it on the screen if you want.
98210
44556.
Right. So I have put it over here, and we will also put it up on our takeaways when we carry them on Monday.
Or if they want to read anything, they can read my book.
That's
Sex
right.
has no expiry date. It's available on Amazon.
We will also give a link to that. So for the benefit of everyone, we will be having the takeaways of this session plus an edited video of the session, which will be put up on YouTube and on our website. So please come to that on Monday. This will be there on our homepage as well as in the webinar section. Thank you, Dr. Jumani, for your time.
Thank you, everyone.
Excellent that you came in and you responded to the various questions that were asked. We had some 22 questions that came in. I couldn't ask 3 of them, but amazing response to your session. Just shows that there is a hunger for correct medical information on sexual health, even for senior citizens. We'd love to have you once again.
Anytime.
And we'd love to have your do a Q&A with you in our magazine and on our website. Thank you once again, Dr. Jumani.
Welcome, sir. Pleasure, sir. Thank you very much.